Good afternoon, members of the Public Health Committee. My name is Dr. Raul Pino. I was nominated by Governor Marlowe last week to take the post at the Department of Public Health. I will wait for confirmation. The Department of Public Health support Governor's Bill number 5053 regarding access to opioid overdose reversal drugs, such as naloxone. This bill will mandate each municipality to amend their local emergency medical services to ensure that the municipality primary emergency provider is equipped with an opioid antagonist and properly trained for the administration of the medication. Such drugs can save life if they are administered in a timely manner. Though they are not substitute for addiction treatment, they may be the first step of an individual recovery. DPH EMS data indicated that naloxone was administered by paramedic personnel across the state more than 2,000 times per year during the period of 2012 and 2014. In recent sessions, statutory authority was given to non-medical personnel to administer the drug. Connecticut State Troopers, especially in rural areas, have successfully administered naloxone in multiple locations. Because different responders may have arrived to the scene at different times, is in part of a rural structure. When you compare urban to rural areas, DPH support the governor's proposal to require each municipality to amend the local EMS plan by designating which local respondent entity will carry naloxone and be trained in the administration of the drug. The proposal allows Connecticut communities to efficiently ensure a quick response without duplicating drug and preventing the drug from expiring. The life of the drug is about 18 months. This will also prohibit commercial insurers from requiring prior authorization for the coverage of naloxone. Thanks for the opportunity to testify in front of you, and if you have additional questions, I will try to answer.
Commissioner.
Thank you, Mr. Chairman. I too would like to add my congratulations to you on this nomination. And as Chairman Ritter said, it has to go through the process, and I hope it'll go through that rapidly for you, and looking forward to working with you in the years to come.
Thank you, sir.
Having said that, the concern that we have, obviously, with the epidemic that we have and the need for Narcan, there's no debate on that subject matter at all. It's a first step. It's a very important first step. But my concern is that as a public health policy for you and for us and all of us together, should we be increasing the tent of the people that get trained and not just limited to the police officers and the EMS providers and so on and so forth? And what is the plan in terms of, from a public health point of view, that you would think about where it becomes education for everyone in terms of knowledge on administration of the Narcan? A, what it is, B, what it does. Obviously, it's not the ideal treatment. Avoiding is obviously the ideal treatment, but in reality, in terms of so that the public at large, in a scenario where the sibling is going to give the Narcan administration, or a family member, or a close friend, which is what happens by and large as a first step. So is there such a plan for education for the Narcan administration at a public level?
The short answer is yes. We are looking into developing a training through the C-Train website that will also give us the ability to see who has been trained. The system will also provide the individual with a certificate of completion, and DPH is looking into the technical possibilities of doing this. And your comment is absolutely right. We have to extend the knowledge of the drug, the ability to provide it to everyone who may be in contact with any individual who may face an overdose.
So this certificate that you're talking about, that you're in the process of developing and So that would be for these providers that are already that we're talking about, or for the general public at large?
It could be for anyone who take the training.
Thank you, thank you. And I think that is the step that we need to be thinking about as well,
Yeah.
of this being available and this training being available for everyone, so that if they choose to take it and be certified, then obviously, if the need arises, they are there to do what needs to be done.
Yeah.
Thank you very much. Thank you, Mr. Chair.
Thank